I'm a real estate broker here in Orlando, Florida. Pretty busy. I've got about 100 agents. They keep me on my toes. And when I had my first kidney stone attack, it stopped me cold. I was basically debilitated, couldn't walk, couldn't sit up straight, and could not find relief. And went to the emergency room, and the emergency room said, "Oh, you have the classic signs of a kidney stone."
Well, anybody that's seen or had known anybody with a kidney stone will tell you it's the worst pain they've ever had. The first thing we do is, of course, try to make them comfortable, give them pain medicine.
For the very first one, the treatment options were to take the medication and to see if it would pass naturally, which it did. So about 3 years later, I had the same sort of symptoms and blood in my urine and the pain, and went back to the emergency room. And I went back hoping it would pass naturally, and it didn't.
For patients that conservative therapy has failed or the pain is too severe, we'll offer them surgical treatment. And the surgical treatment for stones in the ureter is called ureteroscopy. This is where we look in their bladder and go up to the stone with a camera scope and break up the stone.
It was an outpatient procedure. Checked in, they took such good care of me, as smooth as could be. And within 2 hours, I believe it was, I was on my way back home. They retrieved it and put a stent in that time period.
A stent is a tube I kind of liken to about as long as a piece of spaghetti, a noodle of spaghetti. There's a curl on each end. The one curl holds it up into the kidney, the other curl keeps it down in the bladder. What that does is allows the kidney to drain, allows those stones to hopefully kind of trickle on down and out.
When I had the stent in, it would seem that I always had to go to the bathroom, whether I did or not. And that's the sensation that I felt for the entire week that I had it in.
It may irritate your bladder enough that you actually may have a little blood in the urine. If you have these things, drinking water will help. Sometimes sitting in a tub of water or taking a hot shower actually helps with that discomfort from the stent.
I would say the recovery from the stent removal was within hours, and within another day I was back on the golf course.
All patients that have kidney stones have a 50% chance of having another stone without lifestyle or dietary changes. And the number one thing patients can do to prevent kidney stones is drink more water.
We actually tell people to look at their urine. If your urine's yellow, you're not drinking enough water. You want it as clear as can be. Also to decrease the sodium in their diet and decrease the amount of protein. So if you can do those three things in particular, those will be helpful.
My advice to any and all patients who are having issues with kidney stones, have it checked out as soon as possible. And the recovery was much shorter than I had anticipated, and back to a full and active life.